And thank you, Jenny. My name is Kim McKenna. I am a training consultant with the Washington State SHIP program. And in Washington State, we actually go by SHIBA, which is the Statewide Health Insurance Benefits Advisors. So in my opinion, healthcare coverage for seniors in our country poses a real problem. As people consider Medicare eligibility, they're faced with more questions than answers. What does Medicare cover? What doesn't it cover? How do I get Medicare? How good is my health right now, and how healthy will I be later? What are the right coverage choices for me now and in the future? It is all so overwhelming. If we were in a live auditorium this afternoon, I would ask you by a show of hands, how many of you would admit with confidence that Medicare is complicated? And yep, I would raise my hand along with you. My guess is that some of you have already done some significant research on your own. I would also guess that you have received all kinds of information, tips, suggestions, and more from friends, family, neighbors, maybe even Joe Namath on TV. This afternoon, my colleagues and I hope to shed some light on this Medicare alphabet soup. And please keep in mind that Medicare enrollment choices may look different for different people due to individual situations and program complexities. Through our presentations today, we hope to help you make informed choices. There are advisors from all around the country, as Jenny mentioned, available to help you plan next steps or answer more specific questions that you might have. During my specific time with you, I will share information about eligibility for the various parts of Medicare. And presentations that follow will share information about enrollment, when to enroll in what parts of Medicare, costs of Medicare, coordination of benefits, and more. All right, let's get started. Okay, so Part A or Part B or Medicare Advantage or maybe Medigap or prescription coverage. I don't know, where do we even start? What do these terms mean? What are my choices and what do I need to do about them? Your journey with Medicare will require you to make some informed choices. You'll need to determine what you want at this point in life and what options will fit best with that. As you explore and research and talk with advisors and others, there are some really important steps, though, that you can take to keep track of what you're hearing and learning. It's a really good idea to keep notes in a Medicare or a healthcare journal or a notebook. Write down the names of people that you talk to about Medicare and Medicare choices, and write down the person, where the person is from and their contact information so that if you need to reach them again, you know how. Also, write down the date of any conversations and note what was said in the conversation, including any actions that you need to take. Keep copies of paperwork, things like letters from Social Security Administration or Medicare, or Department of Social and Health Services, or even enrollment confirmations or welcome packets from different plans that you've enrolled in. And then finally, don't ever give out your Social Security number or your Medicare ID or any other personal information to anyone you don't know and trust. Well, as Jenny and Maggie already talked about, Medicare began as hospital insurance in 1965. And since then, I would say it has undergone a lot of growth and expansion since. Medicare is a very complicated topic, and what Medicare looks like is different for every person. Everyone's health and financial situation is unique, so choices are individual. SHIPs, or State Health Insurance Assistance Programs, were developed to help folks better understand the Medicare program and the choices that they have to get healthcare coverage. There are SHIPs all across the country, and some go by different names, but all provide expert, unbiased, confidential information to help you make sense of Medicare and the associated healthcare coverage choices. Medicare was created as health insurance for the nation's seniors. And now, more than 50 years later, the program covers more than 60 million seniors and individuals with disabilities. It is an important program, and it helps people as they age or are disabled to access health care by providing coverage for healthcare services and supplies. It doesn't, however, cover all medical expenses or the cost of long-term care. Medicare is federal insurance, and it's for people who are 65 or older, certain younger people with disabilities, people with end-stage renal disease. This is permanent kidney failure that might require dialysis or a transplant, and we often refer to it as ESRD. And also those who have Lou Gehrig's disease or ALS. Medicare helps pay for a range of medical services, including hospital stays and physician visits and preventative benefits and more. Enrollment into the Medicare program involves a coordinated effort of government agencies such as the Social Security Administration and the Centers for Medicare and Medicaid Services. People who are able to sign up for Medicare benefits can also get help from their state through a joint federal and state program that's designed to help with some of the costs of Medicare. To apply for this program that's known as the Medicare Savings Program, individuals must have or be eligible for Medicare Part A, which is your hospital insurance, have an income at or below low income limits, and have limited resources. If you're interested in the Medicare Savings Program and you want to find out if you qualify, you can contact your state health insurance assistance program or local SHIP. As I mentioned earlier, Medicare involves a coordination of government agencies. The Centers for Medicare and Medicaid Services, or CMS, is the federal agency that runs the Medicare program. CMS is a branch of the Department of Health and Human Services, or HHS, and CMS also monitors Medicaid programs offered by each state. The Social Security Administration, or Railroad Retirement Board, if you're retiring from the railroad, enrolls you in Original Medicare, Part A and Part B. Social Security works with CMS by enrolling people in Medicare. And you don't need to sign up for Medicare each year, but each year you do have an opportunity to review your coverage and make some plan changes. Again, Medicare doesn't cover everything, and beneficiaries share the cost of their care. Generally, Medicare pays 80% of necessary charges for services that are provided by Medicare-approved providers. Let's take a look at the 4 primary parts of Medicare that covers very specific services. So first is Original Medicare, and this includes Part A and Part B, which are hospital and medical coverage. Part D is prescription drug coverage. And Part C includes Medicare Advantage health plans that typically cover Part A hospital, Part B medical, and Part D prescriptions. Also are available Medicare supplement plans, and these are usually referred to as Medigaps. These are plans that help cover costs for hospital and medical services after Medicare has paid its part. With Medicare, you have options in how you get your coverage. Once you enroll, you'll need to decide which coverage choice fits your situation best. There are 2 primary or main ways or paths to choose from. The Original Medicare path, which includes your enrollment in Part A hospital and Part B medical, with the added choice of prescription coverage as well as a Medigap plan. And you see this on the left side of this graphic. Or the Medicare Advantage plans, or Part C, are another path by which you can receive your Medicare coverage. Part C, or Medicare Advantage plans, typically include Part A, Part B, and Part D, and we often refer to this as a bundled package of coverage. And that's the arrow that you see on the right side of the graphic. Let's take a look at Original Medicare and program eligibility. So first, what are Parts A and B? Part A covers hospital stays, specifically inpatient hospital stays. A stay in a skilled nursing facility, which this would be a facility for rehabilitation and recovery following a health event. It also covers some home health services like part-time nursing care or physical therapy. And Part A covers hospice care as well. Part B covers your doctors, outpatient services, lab tests, durable medical equipment like walkers and wheelchairs, and other preventative services. Services are paid as you get them, and when you do get services, you'll pay a deductible and 20% of the cost of the Medicare-approved service. All right, so far we've talked about what Medicare is and sort of generally who can get Medicare. We've defined original Medicare as hospital and medical coverage, or Part A and Part B. So let's talk a little bit more about Part A and who can enroll, as well as some other details. And as we go along, please keep in mind that I'm providing a broad overview. There will be more details in presentations to follow. As I mentioned, Part A is hospital coverage, and it covers things like services that you receive as an inpatient in the hospital or in a skilled nursing facility. So for example, hospital room and board, or nursing care, diagnostic tests, home health services, and hospice. And as we've talked about, Medicare doesn't cover everything, and those enrolled in Medicare have to pay some for their coverage. Most people don't pay a monthly premium for Medicare Part A if they or their spouse paid Medicare taxes while working for 40 quarters, which is essentially 10 years. This is referred to as premium-free Part A. If you or your spouse have not worked and paid Medicare taxes for 40 quarters or 10 years, you will pay a monthly premium to have your Part A hospital coverage. And in 2021, Part A premiums for those who have paid Medicare taxes less than 10 or more years will be either $259 a month or $471 a month, and it depends on your work history. You will have premium-free Part A at age 65 if you or your spouse have worked 40 quarters, again, 10 years, and paid Medicare taxes, or if you or your spouse already get retirement benefits from Social Security or the Railroad Retirement Board, or if you or your spouse are eligible for Social Security or Railroad Retirement benefits but haven't filed for them yet. If you're under age 65, you can get premium-free Part A if you received Social Security or Railroad Disability benefits for 24 months, or if you have end-stage renal disease and meet certain requirements. If you don't qualify for premium-free Part A, you can buy it. You can buy Part A and pay a premium each month of either $259 or $471, again, depending on how many qualifying work quarters you have established. If you choose not to buy Part A, you can still buy Part B. And in most cases, if you choose to buy Part A, you must also have Medicare Part B medical insurance and pay monthly premiums for your Part A and your Part B. To find out what your monthly Part A premium would be if you have to buy it, you can contact the Social Security Administration and they can help determine that. All right, let's take a little closer look at Medicare Part B. Remember that this is our medical insurance. So earlier we talked about what Part B covers, and you might remember that Part B is our medical insurance that covers doctors' services, outpatient services, durable medical equipment like walkers and CPAP machines and more. To be eligible for Part B, you must be entitled, to Part A, be 65 or older and a U.S. citizen or resident. Some people automatically get their Medicare Part B, and some people need to sign up for it. If you're receiving Social Security or railroad benefits, you are automatically enrolled in both premium-free Part A and Part B. Individuals not receiving Social Security or railroad benefits are not automatically enrolled and will need to actively enroll through the Social Security Administration. You pay a monthly premium for Part B, and your premium will be deducted from your benefit payment if you get benefits from Social Security or the Railroad Retirement Board. If you don't get these benefits, you'll get a bill, and you can talk with Social Security when you enroll about how you would like to pay your premiums. Anyone enrolled or eligible for premium-free Part A can enroll in Part B, and the standard Part B monthly premium in 2021 is $148.50. However, if your modified adjusted gross income is above a certain amount, you may pay an income-related amount. And Medicare uses the adjusted gross income reported on your IRS tax return from 2 years ago to determine what your premium payment would be. All right, so now we've talked about original Medicare as hospital and medical coverage, and we've talked about when you're eligible. Hopefully you're still with me, because we've got some more to look at and more to talk about. Original Medicare covers some really important parts of healthcare, but really this is just the start of your Medicare journey. And once we've figured out hospital and medical coverage, next we can decide on prescription drug coverage. This is our Part D. Medicare drug coverage helps pay for prescription drugs that you need. And even if you don't take prescription drugs right now, you should still consider getting drug coverage. Prescription drug coverage is optional, and it's offered to everyone with Medicare. If you decide not to get it when you're first eligible and you don't have other coverage as good as Medicare or even better, like through an employer group plan, you may pay a late enrollment penalty when you join at a later time. To get prescription coverage, you must join a Medicare-approved plan that offers drug coverage. And each plan can vary in its costs and its coverage of various medications. There are two ways that you can participate in prescription plans. You can add a Part D plan to your original Medicare Part A and Part B, or you can enroll in a Part C Medicare Advantage plan that offers prescription drug coverage. Most, but not all, Advantage plans do include drug coverage. Prescription coverage is only available through Medicare-approved private plans. So in general, you're eligible to enroll in a Medicare prescription drug plan if you have Medicare Part A, Medicare Part B, or both. If you do not have other drug coverage as good as Medicare plans or better, then you should enroll in a Part D plan. You can also enroll in a Medicare prescription drug plan if you permanently reside in the drug plan's service area, and if you are a U.S. citizen or are lawfully present in the United States. Something to note is that individuals who are living abroad or are incarcerated are not eligible for Part D, as he or she cannot meet the requirement of permanently residing in the service area of a Part D plan. Also keep in mind that there are specific times when you can sign up for Part D plans or make changes to coverage you already have. Now, remember the graphic at the beginning of my presentation with the blue arrow, and it demonstrated the original Medicare pathway? There's one more coverage choice available on the original Medicare path, Medicare supplement plans. And these are the final piece that can be added to our original Medicare pieces. At this point, we've defined Part A as hospital coverage, Part B as medical coverage, and who can enroll. Then we looked at who can enroll in a prescription drug plan, or Part D. Now we have a choice of adding a Medicare supplement plan. So let's take a look at what supplement plans are. Medicare supplement plans, also known as Medigap plans, are sold by private insurance companies, and they help pay the costs of hospital and medical services that Medicare doesn't fully cover. Medicare pays for much, but not all of the costs of covered healthcare services and supplies. Original Medicare pays 80% of approved services and supplies. Medicare supplement plans then cover the remaining out-of-pocket costs after Medicare has paid, therefore paying the gaps in coverage. This is why we call them Medigaps. Medicaps are sold by private insurance companies, and they're regulated by individual states. Some of the costs that they help cover include co-pays and co-insurance and deductibles. Some Medicaps also cover services that original Medicare doesn't cover, like medical care when you travel outside the US. Medigap plans are standardized, and they must follow federal and state laws designed to protect you and must be clearly identified as Medicare supplement insurance. Insurance companies can sell only standardized plans. So how do I buy a supplement plan? Well, you have to be enrolled in both Medicare Part A and Medicare Part B. And the best time to buy a Medigap plan is during your what's called Medicap open enrollment period. This is a 6-month period that begins the first day of the month that you're 65 or older and enrolled in Part B. Medigap plans can be purchased from any insurance company that is licensed in your state to sell these plans. You pay the private insurance company a monthly premium at enrollment, in addition to your Part B premium that you pay to Medicare. Medicaps do not cover Medicare Advantage plans, and they cannot be sold to someone with a Medicare Advantage plan unless that individual plans to drop their Advantage plan and then return to original Medicare. All right, so far we've walked the path of original Medicare. We've looked at eligibility for Part A, Part B, Part D prescription coverage, and the addition of a Medicare supplement to help with the hospital and medical costs. So now we're going to move to the other side of our graphic, to the blue arrow that shows the path of Part C, or Medicare Advantage plans. Part C is just another Medicare health plan choice. And these are plans that are called Medicare Advantage plans or Medicare health plans. Advantage plans are another way to get your Medicare Part A and Part B coverage. And they're offered by Medicare-approved private companies that must follow rules set by Medicare. Most Advantage plans, but not all, do include drug coverage. The Medicare Advantage pathway is just another way to receive your Medicare. You're still in the Medicare program, but with Part C, your benefits are provided through private insurance companies that agree to Medicare's rules. In most cases, coverage will include Part A, Part B, and Part D drug coverage. The costs of Advantage plans can vary. However, you still pay your Part B premium to Medicare in addition to any Part C costs. Plan coverage is defined by the plan's service area, and typically you must live in the county where the plan is sold. In many cases, you'll need to use healthcare providers or doctors who participate in the plan's network and provide care in the plan's service area for the lowest costs. These plans set a limit on what you'll have to pay out of pocket each year for covered services to help protect you from unexpected costs. And remember, you must use the card from your Medicare Advantage plan to get your Medicare covered services. But keep your red, white, and blue Medicare card in a safe place because you'll need it if you ever switch back to original Medicare. Okay, so to join an Advantage plan, you must have Part A and Part B. You must live in the plan service area, and you can join or leave a Medicare Advantage plan only at certain times of the year. I'm coming to the end of my time with you now, and the information that I've provided is really just the start. I can't promise you that during this event, Medicare will remarkably become less confusing, but what I can promise is that my colleagues and I are committed to helping you get the information you need to make the best Medicare choices for you. I am confident that you'll walk away from this event armed with good information and a clearer understanding. You most likely will have more questions, and you may wish to talk with a trusted advisor about your enrollment options. Remember to keep notes and information in a notebook so that you can refer back to it when you need. There's a lot of information to share with you, and presentations that will follow by my SHIP partners will provide important details about enrollment and costs and coordination of benefits and the different Medicare coverage options. So please stay tuned and stay with us as long as you can. I thank you so much for your time today and encourage you to visit your state's exhibits for more information and materials that will help you along your Medicare journey. Thank you.